Have you recently had surgery? If the answer is yes, you might find useful this presentation about wound healing and care. First of all, you should know that wound healing doesn't finish when you may think. In fact, wound healing is a complex and dynamic process in which three phases have been identified. The first is the inflammatory phase. It lasts about 3 days and overlaps with the second phase, the proliferative phase. It's in this second phase when the deposition of the fibers, essentially collagen, that will make up the scar starts, and when the contraction of the scar, more or less discrete depending on the characteristics of the skin, will take place. 1 month after surgery, we can appreciate, more or less, the appearance that the final scar will exhibit. But this scar remodeling is an ongoing process that takes up to 1 year to finish. This is when the maturation, the third phase, takes place. As a consequence, if you want to have better cosmetic results, this implies that you can do something by managing well your scar all this time. Where is your scar located? This is important, and depending on the location, your doctor may give you different instructions. Always follow the recommendations. So location is relevant. It's not the same a wound located on the back than on the face. It's completely different, and this means different ways of perceiving. For example, a wound located on the back is under a lot of tension. We have very potent and strong muscles here, so these wounds are more prone to dehiscence and leave wider scars. Dehiscence means the opening of the wound along the surgical incision. This happens if you move too much the operated region or the wound becomes infected. So, always follow the instructions of your doctor and nurse. They may tell you not to move the region for a few days, elevating the leg if the surgical wound is at this level, etc. That will depend on the characteristics of the wound and the surgical procedure. But as a general recommendation, don't move the operated region the first 3 to 5 days after surgery when the risk of dehiscence is higher. There are many other factors that you should take into account because they can have an impact on the final scar or they can interfere with the normal wound healing process. The final scar will depend, of course, on the size of the wound. This is obvious. The bigger the wound, the bigger the scar. But it also depends, as I explained earlier, on the location. And there is another factor to consider, which is the patient's age. This is interesting in two ways. On the one hand, it is well known that in elderly people we can perform a complicated surgery on the face with a huge scar in the beginning, but after a few months the improvement is dramatic, and finally, after a few years, the cosmetic appearance of the final scar is amazing. This is due to the laxity of the skin in this population group. The loose tissue contracts more, so the final size of the scar is smaller than it could have been in a younger individual. On the other hand, we know that with aging, the ability of our tissues to repair is lower, so the elderly are more susceptible to poor wound healing, infections, wound dehiscence, and chronic ulcers. Some drugs inhibit cell division, delaying wound healing and contraction. Your doctor will tell you about this, but ask if you have any doubts. For the same reason, there are illnesses that compromise wound healing, like diabetes mellitus. Diabetes is a multisystemic disorder that compromises the irrigation and innervation of the wound. If you are diabetic, your wounds will require special care and tightly control of your blood sugar. If not, the risk of dehiscence and infection are high. Radiation therapy is used in many types of cancers and also interferes with the normal wound healing process. Psychological or physical stress also compromise wound healing. The basic explanation is that under stress, the sympathetic nervous system is stimulated. This is the part of our autonomic nervous system which is activated in emergency situations. For example, if you're running for your life because a lion is chasing you, Then the system is activated. This is known as the flight or fight response. In this case, blood to the skin is not as necessary that, for example, to the muscles, so the small blood vessels in the skin become narrower. This is known as vasoconstriction. If you have a wound that is not properly irrigated, it doesn't receive the nutrients and cells necessary to heal properly. Nicotine in cigarettes has a similar effect. It is a potent vasoconstrictor, so it also interferes with wound healing. Your surgeon will normally recommend to stop smoking for 6 weeks before the surgery. You should do it, and for good. It is well demonstrated its negative effects on wound healing. For example, it's been established that the risk of wound infection is clearly higher in smokers than in non-smokers. This is also obvious: nutrition. In essence, if the person is not correctly nourished, the ability of tissue repairing is also compromised. And finally, if the wound is infected, the normal stages of wound healing will not take place. The wound will open and it will cure by second intention, with probably a worse aesthetic result. So these are most of the exogenous and endogenous factors affecting wound healing. What do you have to do if you see that your scar is growing abnormally? In this case, you should immediately seek advice from your doctor. These are complications, and sometimes they require special management. Hypertrophic scars tend to appear soon after surgery and can solve spontaneously, but keloids are more complicated. While hypertrophic scars grow within the borders of the wound, keloids go beyond them and can appear as late as a year after surgery, until the third and last phase of wound healing, the maturation phase, is completed. Factors that have been associated with a higher risk of hypertrophic scars, keloids, are dark skin, certain locations, pre-external, deltoid, the earlobes, and wounds that cross the skin tension lines, closing wounds under tension. So what can you do to take care of your wound and your scar? After surgery, you will follow the recommendations given by your doctor. The way of managing a wound depends on the characteristics of it, but general recommendations are that you keep it clean, washing it every day and drying it gently, and applying an antiseptic like chlorhexidine or povidone iodine. It's been also demonstrated that wounds heal better in a moist environment, so the first few days you may apply an ointment like petroleum jelly and cover the wound with an occlusive or semi-occlusive dressing. And as I explained earlier, you have to avoid moving the operated region a lot, or you should have your legs elevated in case of surgery at this level. In any case, I repeat, these are general recommendations to avoid dehiscence and infection, but each case is particular, so follow the advice of your doctor and your nurse. When the wound is closed, how can you take proper care of this scar? Remember, the scar continues developing up to a year after surgery, so there are measures that you can take for a better aesthetic outcome. I generally recommend silicone, either silicone gels or patches. For me, this is basic and, in my opinion, the best treatment available. This prevents hypertrophic scars and improves the final aesthetic appearance. Follow the instructions of the product. Ask your doctor or your pharmacist if in doubt, and use the presentation more suitable and comfortable to you. Other well-known measures are keeping your skin moisturized with a good moisturizer, massaging your skin gently, and you can also use Rosa Mosqueta oil. The last but not the least is that you need to protect your scar from ultraviolet radiation. Actually, we all need to protect our skin from ultraviolet rays. How? First, Seek shade. Sun is not our enemy, but we shouldn't expose too much to it. Protect your skin with clothing. Protect your eyes with sunglasses, and your scalp and face with a hat. Definitely, sunscreen is not enough. Of course, you have to use sunscreen. I always recommend sunscreen with at least 50 SPF. Reapply it regularly and generously. Forget about water resistance. Reapply it after swimming. Of course, avoid tanning beds and sun lamps. These are your skin's worst enemies. Finally, ask your doctor if you need to take vitamin D supplement. We don't need that much ultraviolet rays to produce vitamin D in our skin, but it depends also on your case, and maybe your doctor deems necessary checking your vitamin D levels.